Welcome to today's event. My name is Dove Sachs. I'm the interim director of the Institute at Brown for Environment and Society. And today's seminar is jointly being held by the School of Public Health and the Institute at Brown for Environment and Society. I'll just tell you a few brief things about the Institute, and then we'll move on with the program. So the Institute has been around since 2014, and it builds on prior units at Brown. It has an interdisciplinary unit, and it's an interdisciplinary mission to work across the natural and social sciences in solving environmental problems. We do amazing education and training and research, and we try to have big impacts as well. So anyway, check out the website, ibes@brown.edu, if you have more questions. A couple general points about the talk today. It is being recorded, so that's one thing to know. It'll be available later. Another thing is that if you have questions, please put them down in the Q&A box, and at the end of the session, as time allows, we'll try to get to all of your questions. I'm going to turn things over now to Dr. Megan Rainey, who is Associate Dean of Strategy and Innovation at the School of Public Health. So thank you, Dr. Rainey.
Thank you, Dr. Sachs. It is a joy to be back with all of you for our second talk in our Climate Change and Health series. So excited about our partnership between the School of Public Health and IBES, knowing that climate change and health, as we've discussed, is a huge focus area for us at the School of Public Health. So today I'm honored and excited to introduce Dr. Michelle Bell, the Mary E. Pinchot Professor of Environmental Health at the Yale University School of the Environment. She's also director of the EPA-funded Solutions to Energy, Air, Climate, and Health, or SEARCH Center, and has secondary appointments at the Yale School of Public Health and the Yale School of Engineering. Dr. Bell's research investigates how human health is affected by environmental conditions, including air pollution and weather. And her other research interests include the health impacts of climate change and environmental justice. Appropriate for this joint talk between IBES and the School of Public Health, much of Michelle's work is based in epidemiology, biostatistics, and environmental engineering, and is designed to be policy relevant and to contribute to well-informed decision-making to better protect human health and to benefit society. It's not just scientifically rigorous and on a topic that all of us care deeply about, but it's also specifically done in a way that facilitates it having impact, which I think is all of our goals as academics and scholars. So Dr. Bell, it is our pleasure to welcome you. I will turn it over to you and look forward to your talk. Thank you for joining us today.
Great. Thank you so much for the invitation to be with you today and to share my work. I'm very excited to get to meet with you virtually. I hope to come meet with many of you in person at some point in the future. Could someone just let me know if my slides are up in presentation mode?
They're working great.
Okay, great. Thank you. Okay, so today I want to talk to you about some of the work we've been doing linking weather, health, and climate change. Let me just give you a rundown of the talk I prepared for you today. I'm going to have some very brief background on climate change. Then I want to share with you some different research that we've been conducting. And I want to begin by saying that there are many other wonderful scholars around the world that are conducting related research. So I'll be giving you examples from my research team, but there are many other researchers doing similar work as well. I'm going to start talking about links between temperature and health. Then I want to move to talking about heat waves, so extended periods of heat and health. I want to give you an example of how we extended this work to estimate mortality from heat waves under a changing climate in the city of Chicago. And then I want to share with you just a couple of examples where we're doing more direct policy analysis, looking at heat wave warning systems, first in Korea, and then a different way of looking at this in India. But you know, our changes in climate and the meteorological conditions are not just going to have a direct impact on health, but have many other impacts as well. We could talk about drought. There are many examples, but one that I've chosen to share with you today is some of my work looking at wildfires and human health under a changing climate. And then I'll just have a few concluding thoughts. So let's start with some brief background. Well, the people on this seminar probably already know, I'm sure know, that the temperature is increasing over time. And we have the 19 of the 20 warmest years on record in the past 20 years, with just one exception. 2020 was tied as the warmest year on record, tied with 2016, and that's since they started keeping records in 1880. So we're expecting an overall warming, but not just moving the distribution up, but an increase in extremes, an increase in extreme temperatures, both at the high end and at the low end. And this climate change is going to have many different impacts on environmental systems. Here I've just listed a few: agriculture, coastal areas, water resources, and so on. But we could also think about the impact between climate change and human health. And I've always been very excited that Brown University has given a lot of attention to this important topic. I think this is really important to discuss in terms of the context of policy and climate change. Still, when we talk to policymakers or when I read about climate change in the general media, New York Times, and so on, much of the discussion is about critically important issues like biodiversity, ecosystems, sea level rise, and so on. But there's really much less attention paid to human health. In my opinion, it strongly warrants more attention, because if you talk to people about why they care about climate or look at surveys of why people care about climate, almost always human health is the primary cause. And if we look at policies on environmental issues, many of them are aimed at things like conservation and biodiversity and so on, but the primary driver is usually human health. So if we're not bringing human health to the conversation on climate change, we're really not giving people the full picture of the damage that climate change can cause. This is a figure that I made just looking at scientific publications, looking at human health and climate change, tracking from 2007 to through 2020. And you can see this incredible rise in the number of scientific publications. Now, what this graph isn't showing you is what those publications found. But we see by looking at synthesis and review articles that overwhelmingly the scientific research shows enormous impacts on public health from climate change. So this, I think, shows not only a growing scientific interest, but growing scientific evidence that climate change is anticipated to have enormous adverse impacts on public health. Well, let's talk a little bit more about one specific type of environmental exposure. And here I want to talk about temperature and health. Now, this is a photo of the Blue Ridge Mountains where I'm from, and I deliberately picked a picture from a time frame when it's cold, because much of the discussion on weather and health under a changing climate, or even weather and health in general, is about heat and heat waves. And that's really important. But again, we have to think about, or I like to think about this in terms of making real impact to decision makers. And when I talk to decision makers and people in Congress and so on about weather and human health and heat waves, I always get asked over and over, what about cold? So you're going to have more deaths from heat, but won't you have fewer deaths from cold? Don't they cancel each other out? And the answer is the scientific evidence says no. We will have an overall increase in public health burden. But I do think it's a reasonable question to ask and demonstrates why I like to try to look at the full picture and the full system. So this is some work from my former student, actually my first PhD student, Brooke Anderson, who's now a professor at Colorado State University. And this is some work from several years ago looking at the relationship between temperature and mortality for New York City. And I pulled this figure because I want to discuss several features of it. I don't know if you can see my little arrow cursor, but on the right-hand side of the screen in pink, that's the heat effect. And that's a lag 0 1 day in this analysis. So that's what's my risk of dying based on the temperature I'm exposed to today and yesterday. And you can see as the temperature gets higher, the risk goes up. Now the left side of this figure in blue is the cold effect. And that's a lag 0 to 25 days. We often go 0 to 20, several weeks. And again, as the temperature gets more extreme, the risk of mortality goes up. Now, these different lag structures are really important, because sometimes in the early research, and even still, you'll see people use the same lag structure for both heat and cold, but the biological mechanisms through which your body succumbs to heat or your body succumbs to cold are actually quite different. So we're really not getting the full picture and the full estimates unless we think of these as kind of separate phenomena. Another really fascinating thing for exposure of temperature is that it behaves very differently from a traditional environmental exposure. So if you think about air pollution or water pollution, normally as the exposure level goes up, the health risk goes up. But for weather, we see the highest risk both at the very high levels of exposure and the very low levels of exposure. So you have this kind of U shape. So it's very different from other types of environmental conditions. Now this figure looks different in different cities. Here I'm showing you another example. This is from one of my research scientists, Jiyoung Sun. And Dr. Sun's work is showing a very similar figure with the heat effect and the cold effect, but this time it's for Sao Paulo. So a couple of points I want to make here. One, the figure differs by different cities. And two, we see effects in mild climates. So Sao Paulo really doesn't get that cold ever by I think most people's standards. But we still see that as it gets cold for that city, we see an increase in mortality rate. In fact, that cold effect is actually quite strong. So when we think about weather and climate change, what do we think this figure is going to look like in the future? It's not just that the distribution of temperature is going to shift, but how will this curve shift? Will people adapt so that that slope will come down? And there's different types of adaptation. There could be physiological adaptation. There's difference in housing characteristics, difference in behavior, heat wave warning systems, and how fast can a city adapt? So some methods of adaptation, like installing central air conditioning, could happen relatively quickly. That has its own issues. There are economic issues there, and also issues of energy consumption. But then other types of adaptation, such as to buildings, would happen very slowly or not at all. Think about major apartment buildings in the US where people have elevators primarily, and major apartment buildings in, say, older European cities where people still have a lot of stairs and walk-ups. So that type of adaptation can happen fast in some ways and slow in others. So we'd really like to know what this curve looks like in the future. And this is more work from Brooke Anderson. It's the same Brooke Anderson, it's just a different photo. And this figure is showing you the heat effect. Here she's pulling off 2 points off of that nonlinear curve I showed earlier. So it's the risk of mortality at the 99th percentile of temperature compared to the 90th. And larger circles have more statistical certainty. So what you see here, there's 2 points I want to demonstrate with this figure. One is there's huge variability in what the weather health relationship looks like. It's not the same. And this relates to different forms of adaptation. The second point I want to make is if you look at where those orange and red circles are, so where is the biggest heat effect? It's not in the hottest places. If you look in the southeastern part of the United States, we see that there is a heat effect, but it's much less, even though that part of the country is hotter. So again, it's this kind of strange thing that happens where the biggest effects are not in the places with the highest exposure as well. So what about heat waves? Heat waves are a little different. By heat waves, we're referring to multiple consecutive days with high temperatures. And your body responds differently if you have one day of high temperature versus you have high days of temperature several days previous. And so this work from Brooke Anderson, I'm going to walk you through this figure. We're looking at what is the relationship between mortality and different types of heat waves. So some of the earlier work on heat waves and some heat wave work still looks at the risk on a heat wave day compared to a non-heat wave day. And that's a really great way to look at it. But not all heat waves are created equally. And what Dr. Anderson showed is that, as you would expect, heat waves that are more intense, so hotter, have a higher impact on mortality. We also found that heat waves that are longer have a higher impact on mortality, but this relationship is a little complicated. So by the time you get up to 10 or so days, maybe even less of heat waves, that public health burden actually starts to go down. 2 reasons. One, people are adapting. They know this heat wave is happening. And 2, the most susceptible and vulnerable populations have already succumbed. And this is an interesting one. This is looking at timing and season. So here, what we're looking at is which heat waves are most harmful in terms of the warm season. Is it the first heat wave that just kind of hits you? Or was it the last heat wave after you've had these repeated stressors? Well, it turns out for the United States, the first heat wave is the most harmful. That's why this is a negative coefficient. So the first heat wave is the most harmful, the first heat wave in the warm season. And then by the time you get to heat waves in August, they are less harmful. Again, people are adapting and your most susceptible, vulnerable populations have succumbed. Now, this is not universally true. In fact, our work in India by Amruta Norisarma, one of my former students. So Amruta's work showed that in India, the latter heat waves appear to be more harmful. So that first heat wave in the warm season is harmful. And then as you get those repeated stressors of heat waves, by the time you get to the end of the the warm season, those heat waves are even more harmful. So again, really big differences across locations. This is more work by Dr. Sun, and this is looking at 7 cities in Korea, 7 large cities in South Korea. And here what she's interested in looking at is who's actually being affected by heat waves. And I want to share with you 2 results. One is looking at age. So she found that the heat waves were most impactful, and this is on mortality, for the older populations. Now, this is not a big surprise, but it really is important because these heat waves and weather events are not impacting populations in the same way. And also on the lowest level of education, which also could be thought of as a marker for socioeconomic status. There are other ways we could look at heat wave and weather impacts on public health as well for different subpopulations. But my point here is that these coefficients that we see and these impacts on populations are not affecting everyone equally. You can also think about which of these populations have the biggest ability to adapt. It's not the lowest educated with the lowest economic resources. So let me shift gears a little bit and start thinking about how we might do some analysis for policy. And so we do a lot of work looking at heat wave warning systems and what is their benefit to public health. And so first I'm going to give you an example from Korea and then a different type of example for India. And so you can see here, this is a picture taken in Korea during a heat wave. You can see people have their personal fans. So that's an adaptation mechanism available to some, right? Now there's a lot going on when we think about designing a heat wave warning system. And so there are many different types of disciplines that we need to contribute to our understanding of heat wave warning systems. One is psychology. In what ways do we get people to comply with the heat wave warning system versus in what ways might people ignore it? Communications, how do people want to receive this information? Is it a text on their phone? Is it on a Facebook page? Is it on social media? What's the best way to get this information out? And so I'm not going to be talking about either of those. I'm going to be talking about where do you set the heat wave warning system, because there is no standard definition of heat waves, either in policy or in science worldwide. But they typically have 2 criteria. One is duration, like a heat wave has to be consecutive hot days of at least 2 days or at least 4 days, depending on your definition. And also intensity, the temperature has to be above a certain level. And so this is work from Solki Ho, a research scientist in my group. Her photo must be on the next slide. And here we're looking at heat wave warning systems, and we're going to take advantage of the heat wave warning system and the actual monitored data. So I'm going to walk you through this, this slide right here. So if you look at just the left-hand slide of this, where it says heat HW, that's heat wave alert positive. That means the government anticipated there was going to be a heat wave. And then if you move to the right, heat wave days, that means it actually was a heat wave day. And move further to the right, it wasn't a heat wave day, that they initiated a heat wave warning system, but turns out the heat wave didn't happen. And then the row below that is heat wave alert negative, that there was no heat wave alert issued. And then for the next column, there actually was a heat wave, it's just they missed it. And then the last one is there no heat wave alert was issued and no heat wave occurred. And this is in no way a criticism of their estimation system. It can't be perfect, but we can take advantage of looking at the health data on days where you thought you had a heat wave warning and you did, and you had a heat wave warning, but you didn't have a heat wave, and all these different combinations. Okay, so there's Dr. Ho. And so here what we have, if you just look at the right-hand side of the figure, these are mortality rates for days with heat wave alert system. So a heat wave was issued and people responded. And then the red dot at the top, that's when a heat wave actually happened. And at the bottom, no heat wave actually happened. So a day that they issue an alert, but a heat wave didn't actually happen, was probably still a hot day. And then on the left-hand side of this figure, we see that, you know, in the upper left, that's days where no heat wave alert was issued, but there actually was a heat wave. And so days that a heat wave was missed is where we have the highest mortality. And then you can see, if you just look at the 2 red dots, the top line, you see on a heat wave without an alert versus a heat wave to an alert, we actually have a big public health improvement. We have mortality rates really going down. And if you look at the bottom one, you still had a public health benefit from the heat wave alert system, even if the heat wave didn't occur, right? Because people still took precautions and the days were hot. But we use difference approaches to estimate what is the actual benefit of these heat waves. And I want to get back to the point that not all people are affected equally. So this is again from Silke Ho's work, and she saw that some of the biggest benefit was for the 75 and older population. And then on the right-hand side, we see people in different socioeconomic strata. And the biggest benefit was really, if we looked at all different strata, was people who were unemployed and 75 and older. There were other strata that she looked at and other types of vulnerable populations as well. I'm just giving you a little subset of her work. But here we can really see the biggest benefit of a heat wave warning system and what populations really had an averted mortality. All right, so I want to show you a different way of looking at some policy analysis for heat wave warning systems. And here I want to take the example of India. This photo I find very fascinating and very frightening. This is literally pavement melting because it's that hot. And this is work by my former student, Dr. Amruta Norisamma, who's getting ready to start a professor position at Boston University. And so here we have 4 different locations. Well, there's 5 cities, 2 of them we've combined because they're close in geography and climate. So we can think of as 4 different locations in India, large metro areas, and that's each of the different shapes, the triangles, squares, and so on. And on the x-axis, we have the number of heat wave days per year, and on the y-axis, attributable mortalities. And these dots are color-coded based on different types of heat wave definitions. So this is showing you what would be the averted mortalities. Assume everybody complies with your heat wave system. We know they don't, but assume that people comply with your heat wave system. What are we estimating to be the averted mortalities under different types of heat wave warning systems? Do you want a stringent one where you really require it to be really hot and you have fewer days per year? Or are you going to say have more heat wave warning systems? Okay. And this is a really, really critical figure that makes a point that I think is not obvious to policymakers. So here I just want to highlight for you 4 points. So we're in one given city, and these 4 points are showing you, let's just look at the x-axis, the number of heat wave days per year. And so these are different heat wave definitions. So if I have that darker orange dot on the left-hand side of my little oval there, I'm requiring a pretty strict heat wave definition. I'm really requiring it to be hot. So I'm going to have fewer heat wave warnings. I probably have about 26 heat wave warning days per year. Moving to the right of those 4 dots, I have a little less strict heat wave warning system. It still has to be hot, maybe not quite as hot. But because of that, I'm going to have more heat wave warning days. So I'm going to have about 33 heat wave warning days per year. But what's interesting is that if you look at the avoided mortalities, they're not that different. Okay, so it's not that different to have the more stringent heat wave warning system as opposed to the less stringent one. So why is this important? Well, imagine if you're in the community and you have 25 heat wave days per year, you might respond in a certain way. But if you have 33 heat wave days per year, you might respond less so. So there's a term called just kind of warning fatigue, heat wave warning fatigue. People just get tired of heat wave warnings. And so if you have a heat wave warning system that's only going to occur 5 days in the summer, people will take that very seriously. If it occurs 50 days in the summer, people kind of stop to ignore it. They want to move on with their lives. They have work to do. They have, want to spend time with friends and so on. So what you want to do is minimize the number of heat wave warning days because that improves the effectiveness of people following that policy, but you want to maximize public health. And what Dr. Norisamma's work is showing is that that trade-off does not necessarily mean that we have to keep capturing more and more and more heat wave days, that we can actually have fewer heat wave warning systems and still get some public health benefit. And this is just an example for another city. So we see this for several cities in India. So the things I've talked about so far are very relevant to climate change, but I actually haven't linked it to a climate change model. So let me try to do that for you now with some work that we did looking at heat waves, mortality, and climate change in the city of Chicago. This is Roger Peng. He's not from my group. In fact, he would be more of a mentor to me. And he's a professor of biostatistics at Johns Hopkins. And so we did some work looking at using global climate change modeling and downscaling that work to look at what heat waves would look like under a future climate change scenario in the city of Chicago, and then estimating what that would mean for mortality. And this is our conceptual framework. I want to talk about several pieces of this. I think it's very useful. So in the upper left-hand side, where it says databases for current conditions, we're estimating how heat waves impact mortality in Chicago in the present day, before we even get to climate change. A point I want to make here is that I personally believe we have to understand these environmental exposure and human health systems very well in the present day before we can really understand them under a changing climate. Not everyone agrees with that scientific philosophy, but I think that's where the best work is. And then the lower half of the left-hand side of this figure talks about different global climate change models. We're gonna look at 7 different projections, and we're gonna get estimates of what heat waves might look like in the future. Different heat waves, more heat waves, how hot are they, how long do they last, and so on. And then the upper right-hand part of this figure with the green boxes is really the most important. So we have more heat waves. We know how heat waves affect human health in the present day. But what are those conditions going to be like in the future? Well, we're going to have population growth. We can estimate that it's going to match our different climate change scenarios. But remember I said that that relationship between heat waves or weather and health is different for different populations? Well, it's a bigger impact for poorer populations than richer populations. Well, what if income inequality continues to grow in the future? It could be different for different race ethnicity, and that distribution is different, and so on. It is changing over time within a given city as adaptation happens, heat wave warning systems happen. The reason mortality rate is up there is because baseline health is overall improving in the United States, and other factors as well. And so what I like about this figure and this paper is that we try to be very forthcoming about the uncertainties of the system that we're addressing, and then the uncertainties about the system that we're not addressing as well. And so this is some estimates of the number of deaths per year from heat waves and mortality under a changing climate. And the 3 different horizontal bars represent 3 different types of climate change scenarios. Within one of those horizontal bars, you'll have 7 different estimates, and those represent 7 different climate models. So some things I want to point out about this figure. One is the results show an increase in mortality from increases in heat waves under a changing climate for the city of Chicago. That is clear. The second thing I want to point out is the uncertainty is really more for what climate change model we used, not what policy scenario we used. So that means there's actually a lot of uncertainty happening, and that's because we're looking all the way down to a local scale of Chicago. But my follow-up point to that, which I think is really important, is just because we have uncertainty doesn't mean we know nothing, okay? Climate change human health estimates typically come with a lot of uncertainty, but they also tend to come with a consistent trend. So here, even though we have uncertainty on the specific number of mortalities due to the different climate change scenarios, and we could think of in the different policy scenarios, we still see extremely clear trend that climate change will increase heat waves and heat wave characteristics, which will increase mortality. So that much is not uncertain, even though the specific details are uncertain. So I think this is really important because I see decision makers sometimes focus a lot on the uncertainty, which is there, and sometimes have a harder time capturing that the overall message and trends are often quite clear. So I wanted to spend a little bit of the time today talking about a different way that these types of conditions and changes in heat waves and droughts could affect human health. And I want to talk about climate change and air pollution from wildfires. So I'm going to share with you some of that work, but I picked this picture on purpose. And because I want to give you, I like to give a little peek behind the curtain of how this research is conducted. So for this research, we worked with Dr. Loretta Mickley at Harvard, who's one of the world's best wildfire modelers. And anytime you work with modeling data, we want to make sure that it's validated and that evaluation means our estimates are really great. And so the way they validate wildfire models is by looking at things like this picture, like area burned. Did they get the wildfires in the right place? Did they get the area burned right? But for our purposes, for human health, we're not interested in the fire, we're interested in the smoke. The smoke can happen very, very far from the fires. So we had to kind of redo this process and say, just because you validated the model, the wildfire models for one purpose, doesn't mean it's validated for another purpose. Well, fortunately, the models did well in estimating air pollution as well. But this is a really important point for climate change, human health research, where you have lots of interdisciplinary work that's required, we have to make sure that the different disciplines are really understanding each other's needs. And Dr. Mickley and I had a really great collaboration where I think we both learned a lot. Well, I can say I learned a lot from her. And this is work from my former PhD student, Coco Liu. And Dr. Liu looked at the link between wildfire smoke and human health, first of all, in the present day. Remember, I like to understand present day health conditions. So one of the challenges of this type of work is to really estimate the air pollution from wildfires specifically, as opposed to just a day when smoke was high and so on. So we worked with the Harvard team to get estimates of the fine airborne particles specifically from wildfires. So that challenge was taken care of through this collaboration with another discipline. The second thing that was a challenge is that this air pollution behaves so differently from other air pollution we're used to dealing with. So some of you may work with air pollution. And so, you know, the level of air pollution coming from traffic or industry, it might be high or low. It kind of goes up and down. Wildfire is very, very different. It's like nothing crazy high, nothing crazy high. So what Dr. Liu did is generate a concept that she called a smoke wave, which is really very analogous to a heat wave. It's several days of high air pollution, specifically from wildfires. And then she can vary this definition to look at how this impacts human health. And she found that, I'm just going to share one of her findings. She found that comparing smoke wave days to non-smoke wave days, that respiratory hospital admissions for the Medicare population, so this is people 65 and older in the Western US, went up 7%. I want to pull back and put our policy hat on again for a minute. To some people, when I say that respiratory hospital admissions went up 7%, they think that's a very large number. To other people, they think that's not a very large number at all. Well, we really want to think about the public health burden in terms of what that number is applied to. So it's a 7.2% increase in respiratory hospital admissions for an older population that already has higher risk. And it's to everyone that is exposed to wildfire smoke in the western part of the United States. So applying this number to that huge population means that this work showed that air pollution from wildfires actually has a very substantial public health burden. Then we looked at estimating what wildfires and smoke might look like under a changing climate. And I want to share with you some of the figures from that work. So this is also with Loretta Mickley and Coco Liu. And so this map is showing you by counties the difference in the number of smoke waves over a 6-year period in the future compared to the present day. And this is a climate change scenario that's kind of a middle of the road scenario. It's not what I call the Greenpeace scenario, where people really just have very low greenhouse gas emissions, and it's not what I call the Spielberg scenario when everything is out of control. It's a middle of the road scenario. And so what we see here in the orange and red are counties where we anticipate to have more smoke wave events than in the future. So I'm gonna go through several different maps, three related maps. And so you could look at whatever part of the country is of most interest to you, but if you don't have a preference, I suggest you look at Northern California because some interesting things are going to happen. So for Northern California, we see maybe even a slight decrease in the number of smoke waves, or maybe no change. But it's not just the number of smoke waves, it's how long do they last. You could imagine a very large decrease in the number of smoke waves because the whole fire season was one big smoke wave. So now we're looking at change in length. And so again, we see for like Montana and Washington State, Colorado, we see an increase in the length. So these smoke waves, these wildfire air pollution episodes are anticipated to last longer. Again, in Northern California, they're actually shorter. But there's still more. We need to think about how intense they are. And this is where the picture becomes fuller. So now we see that almost everywhere, although not everywhere, but almost everywhere, including Northern California, those air pollution episodes that do occur from wildfires are anticipated to be more intense, and intense is the level of air pollution. So we really need to look at these multiple different characteristics of air pollution episodes, including under climate change, to really get a full picture. And overall, under climate change, we anticipated and estimated that wildfires are overall expected to occur more often and last longer and burn hotter, producing more air pollution. I want to share with you some more work. It's also with Dr. Loretta Mickley, and this is with a former master's student of mine, Lucia Wu. And Lucia was interested in how wildfire smoke might change under climate change for the state of Alaska. And so we looked at different time periods. This is just showing you 1 month for Alaska, and you can see that all of Alaska is anticipated to have an increase in wildfire air pollution, but that northern part and that kind of northeast part of Alaska really are anticipated to have the biggest increases in wildfire smoke. And so Lucia presented this work in Alaska and met with different Native American tribes and learned more about how the populations of those different tribes are distributed in Alaska. And this, I just want to show you one map. This is the population distribution of the Alaskan Athabascan tribe. And you can see that where these individuals live really overlaps very much with where those anticipated smoke exposures are expected to have the biggest increase. And so this is a figure showing you just for the present day what smoke exposure looks like throughout the year, and each colored line is a different indigenous tribe. And so the Alaskan Athabascan, because of the spatial patterns of wildfire smoke and the spatial patterns of where these populations live, we estimate that in the present day and under a changing climate are going to get hit the hardest with increases in wildfire pollution. So again, going to the point that not all populations are going to be affected equally, Lucia found that large areas of Alaska are anticipated to have a doubling or even a tripling of air pollution from wildfires, but with very strong implications for indigenous people, with some of them facing a very high disproportionate burden. And I want to just highlight some other research that's happening with my group. These are a couple of preliminary studies relating to weather and health under a changing climate. I'm just going to give you 2 examples. The first is from my PhD candidate, Yan Shui, who's looking at temperature and mortality in North Carolina. You'll see that figure that's somewhat similar to what we showed earlier for Sao Paulo and New York City. And so interesting here, most parts of North Carolina do not get that cold, but we still see a very strong cold effect. And then Dr. Sulki Ho is looking at the temperature hospitalization relationship by green space. And so what we mean by that is that the relationship between weather and health is changing over time. So she's looking at temperatures and risk of hospitalizations for the Medicare population. So this is changing over time. And she's looking at whether or not that temporal trend varies depending on areas that have a lot of green space and vegetation and areas that have less green space and vegetation. So I'm almost done. Let me just give you a few concluding thoughts. Just very simply, I just want to have kind of a mini recap of some of the concepts I talked about. We have multiple complex pathways between climate change and human health related to not only the environmental exposure, but also our health, changes in healthcare status, changes in populations, socio-demographic and cultural issues, issues of adaptation, and so on. We see health impacts from cold, heat, and heat waves. So even though most of the discussion still is on heat and heat waves, to get the full picture, we want to incorporate cold as well. I talked about how these impacts have a lot of variability. So we see heterogeneity by location, by subpopulation within a location, and also, for example, by the different type of heat wave. Is that heat wave hotter? Does it last a long time? And so on. Interestingly, the highest impacts are not in the places with the highest exposure, and we do see impacts in mild climates. And it's not just weather. I just gave you one additional example of wildfires, where we anticipate wildfires to occur more often, last longer, and burn hotter. So I've given a lot of different examples from our research, but there are so many remaining questions. I just put a few examples. How are these impacts going to be under different types of climate change scenarios? How is the health impact of wildfire pollution compared to that of other pollution sources? How do we think about how these impacts might change under different temporal patterns of adaptation, and of course, many more. But I have one last slide, and I've talked a lot about these many different negative adverse human health impacts that we are already experiencing from a changing climate. But I really want to end on a positive message. So I'm just going to have one slide on the topic of co-benefits or co-impacts. So co-impacts refers to the unintended kind of side consequences of a policy on air quality or policy on climate change. They tend to be benefits, so sometimes the language is co-benefits. It technically should be co-impacts, but you'll hear people say co-benefits a lot because it's often co-benefits. And so what I mean by this is that policies to mitigate climate change, to lower greenhouse gas emissions, often include improving air quality in the short term. So an example might be improving public transportation. So the goal might be to lower greenhouse gas emissions, but air quality in that community might improve from that policy in like 5-10 years, even before the climate change results have manifested. Similarly, an air quality policy that's designed to improve air quality in a community in the short term could also be changing public transportation and could have a side effect of lowering greenhouse gas emissions. So both of these types of policy geared toward short-term and long-term consequences have human health benefits, both in the short term and the long term. The term co-benefits is most frequently used to describe the short-term benefits from improved air quality from a climate change policy, but it could be in the reverse also. And so even though this has been known for decades, still these policies are often discussed separately. They're often analyzed separately in scientific research as well, not exclusively, but often. But really, we have an opportunity here where a policy designed to have one benefit can actually have another benefit as well. And again, going to my theme that I always think of trying to capture the full underlying system, we can't make effective decisions about, say, a climate change policy if we don't fully understand the costs and benefits of that policies, some of which may occur well before we even get to the climate change impacts. So I wanted to end on that positive note. And then finally, I want to thank all the members of my team who are amazing and my funding sponsors as well. I have a bunch of references on my slides as well. If anyone is interested in my slides, please send me an email and I'll be glad to share them with you. And I put my email in the chat. Thank you very much.
Thank you, Dr. Bell. That was terrific. And I have to say that I am going to start taking your technique of putting the little picture of my collaborators and mentees on my slides. That was just a lovely statement of the importance of team science, and really, really like that. So on a very meta level, I hope we all take, if nothing else, away that from this talk. I'm going to remind folks to put their questions into the chat if they have questions. I know we have a couple there, and I have a couple as well. So I'm going to start with a question about adaptation and the use of projecting death rates in the future. I think it's something that a lot of us were intrigued by your comments about, and would love to hear you talk a little more about your thought about whether we should or we shouldn't project forwards, and where your limitations and your cautions would be.
So this is very much my kind of scientific philosophy, is that we should, and let me be even bolder, someone will. And if someone will, I would like scientists who really understand the strengths and limitations to be those people, okay? And so I do those types of projections, but I also think it's important to recognize the limitations. And some of these are limitations, just we can't know everything, but what does that mean to our overall estimate? Does that mean we think it might be a little high? Does that mean we think it's totally off? And to just kind of be forthcoming. And this gets to my point of, just because we have uncertainties doesn't mean we know nothing, right? And so I think we should be doing projections, but I think we should also be very careful about in what ways might those numerical estimates be different from what could happen in reality due to some issues like adaptation that we can't really address.
I love that. And I'd actually love to go off of that a little more. I think that, as we've all seen during COVID, one of the big challenges in fields like climate change, like the emerging science around SARS-CoV-2, is that we as scientists or academics make a pronouncement that we know kind of lies within this larger body of work where we're all trying to calibrate, gets picked up by the news media and put out as kind of the truth. How do you handle that in your work, knowing that one of your goals is kind of driving policy change?
I was hoping at the end of your question, you were going to show me how you solved this big problem. So it's very difficult. And I have to say that talking to journalists is, just from talking personally, I'm going to talk very openly, is a bit of a struggle for me. So I greatly appreciate when they're covering this type of work. I think they have a very hard job. It is, not feasible to assume that they're going to have, in-depth scientific training, even though some of them do. They can't have it in everything. But still, like, it really makes me question everything I read, because so much I'm like, that's not what I said or what I meant. So I think that there's kind of, well, a few different points. One is that we all know that the uncertainty is really important, but my second point is uncertainty is not always wanted. So when I talk to decision makers, they almost to a person don't want the uncertainty. In fact, I have literally been told, take it out. We don't want to know that the number is 5, confidence interval, 3 to 7. We want to know that the number is 5. I can't go to my constituents and say the number is 5 probably. Number's 5, right? So I mean, I've explicitly been told, take uncertainty out of presentations because we really just want bottom line. Again, my point that just because we have uncertainty doesn't mean we know nothing. So I think that, in some cases we do have overwhelming consensus, overwhelming trends, and I think we can keep giving that message. And then the final point I want to make is that it's not just about conveying science and conveying uncertainty properly and getting the right points out, that we are in a era of enormous scientific denialism. That's my wording.
Mm-hmm.
And we see this with COVID-19, where people don't believe the vaccines, don't believe that it's even a real disease. Sometimes even if they have it, I mean, it's just really heartbreaking and incredibly damaging. And what we're seeing is the climate change science happening at a rapid pace. It's extremely similar. And so I don't have a solution to that, but I think that, obviously I think we need science, we need great science, and we need to communicate the science, but clearly that is not the only thing that we need to move forward to really get science into policy.
Oh,
So I
I
don't
love
have solutions, but I have many issues.
No, I mean, I'm totally with you, whether it's around COVID or climate change or firearm injury, which is where I do a fair amount of my own work. I think that us not being out there and interacting with the media means that others dominate the discussion, but it's helpful to think of kind of both your cautions and how you handle it. So thank you. There are a couple of questions, both that came in privately as well as in the open Q&A, around this intersection between urbanization and climate change. And to what extent the exposure to the mortality from heat waves is going to increase with the growth of urban areas. I have another question about, to what extent should we be funding changes like greening, more green infrastructure versus investing in home ACs or cooling stations, knowing that an increasing proportion of our population is living in urban areas. So I'd love to hear your thoughts about that, about how our built environment and mortality from heat waves and climate change are going to intersect.
So there's a lot in that question. I probably won't get to everything. So I think, the issue of urbanization is of course critically important. The world is all the world is becoming more and more urban at an incredibly unprecedented rate. And so this actually has a lot of implications for environmental health. And so what's interesting in talking to some of my colleagues in remote sensing who look at urbanization, in their world, when they're looking at energy efficiency, urban means good because there's economy of scales and there are opportunities for education, there's better access to healthcare and so on. From an environmental perspective, there is an additional layer of urban also brings some negative aspects as well, increased water pollution, increased transmission of disease. We saw that in COVID as well, for infectious disease and so on. And of course, the urban heat island effect, as you mentioned. And so some of the work we're doing is looking at the relationship between green space and health, not just for the urban heat island effect, because green space, and here I mean like urban parks, trees, like a whole range of different types of green space, can really have impacts on mental health and well-being, on mood, on physical activity, and on social cohesion. And we're also doing some work with Alicia Chan, my PhD student, looking at green infrastructure as well, and how that impacts vector-borne diseases and how that impacts just kind of the demographics of the population and so on. So I think there's a lot of work that we, the scientists, should be doing to understand, because the urbanization is happening. Like, as they say where I'm from, the cow has left the barn, like it's done. So what we really need to do is think about, what are the best way to plan cities? And I think there's a lot to be done there for green space, vegetation as well, not just for urban heat island, but more broadly. I want to get to your point about air conditioning. So air conditioning is actually pretty fascinating if you look at the history of science. So air conditioning in the 1950s and several decades ago was considered an incredible luxury. And now it's considered standard, as many things. And remember when cell phones were a luxury? Now it's cable, everything, right? So the prevalence of central air conditioning in the United States is rising dramatically everywhere. every location, including like New England, where I live, where I argue it doesn't really get that hot. And every socio-demographic, poor people, rich people, every race, ethnicity, every age distribution, every way that I've been able to parse out the data, central air conditioning is going up. So that adaptation is happening, clearly not for everyone, of course, but that adaptation on a general population scale is happening. It's also producing, it's also consuming energy and producing pollution at the same time. So it's a enormous feedback mechanism. And then there are going to be populations, like if we look at India, where that is not going to be an adaptation mechanism. Like it is not going to happen, or certainly not going to happen on that type of scale. So this inequity, this environmental and social justice issue of who has the ability to adapt versus who does not, is very correlated with who is producing the most greenhouse gas emissions and who is not as well. So there's really a lot there for urbanization. I want to just add one more point about urbanization, which you didn't bring up, but I'm going to add it on,
Thank you.
which is the issue of rural populations. So rural populations actually have been recognized by NIH as an environmental disparity subpopulation, along with low socioeconomic status, along with racial ethnic minorities. And rural populations in the United States have lower lifespans, less access to medical care, less access to medical care specialists, and so on. So this trend of growing income inequity and these trends of urbanization have major impacts for the urban population, but also for the rural populations that are being left behind. And I think that's an understudied area of environmental health research.
I love that last point, that paying attention to geographic disparities in every, not just focusing on urban. I really appreciate that point about the rural populations. One final question, because I know that you are off to Proctor to start your final exam for one of your courses. So a final question is around the economic losses associated with either heat wave warnings, potential smoke wave warnings, wildfire days. I think, again, coming out of the COVID pandemic, where that balance between health and the economy was right, or just looking at the whole debate about climate change, that folks somehow put climate as in opposition to economic success. How do you think about the economic losses associated with either these heat wave days, or on the contrary, quantify the economic losses associated with climate change, with wildfire days themselves?
Yeah, this is really a really good question. So thank you for your question, whoever it was. Part of why, or a big part of why I got interested in wildfire, air pollution, human health research is because I read several US government documents that estimated the economic damage from wildfires. And it was in the many, many, many millions of dollars. And in all of the estimates, this is several years ago, in all of the estimates, there were $0 put in for human health. It was like nobody coughed. And that's not because those agencies didn't know conceptually that something might be happening. It's just there was no scientific evidence for them to incorporate it, and it wasn't. So what does that mean? That means all of the estimates of the economic cost of wildfires are gross underestimates, enormous underestimates. And so if we think about the economic value that is placed on human health, it is enormously huge. And in fact, some economists have told me that the Clean Air Act is the most cost-effective law in United States history, where EPA looked at the costs and benefits of the Clean Air Act and found that depending on how you calculate it, but it's the benefits outweigh the costs by many, many times. And that's largely from avoided mortalities from PM 2.5. Then we learned ozone causes mortality too. Turns out it's actually even bigger, right? So I think, again, to my theme that it comes up in my head several times a day, like what's really happening, what's really the underlying systems. If we're looking at climate change policy, or wildfire management policy, or heat wave policy, if we're not really capturing the full human health impact, then we are grossly underestimating the potential benefit. I know there's cost as well, but if you really want to make an informed decision, the human health, public health burden is enormously costly. And so we really need to incorporate that into all of this work, including looking at heat waves and these other environmental conditions that you mentioned.
Thank you. As an emergency physician, I will say I love that way of ending this talk. Our ER gets filled with COPDers on those super hot days. And so thank you. With that, Dr. Bell, I cannot thank you enough for joining us today. I only wish it could have been in person, but we'll just use this as an excuse to have you back. On behalf of both IBIS and the School of Public Health, thank you both for your tremendous work, for your scientific leadership, and for your helping to drive us all towards a healthier and more environmentally stable future. Really appreciate your taking time out of your day to give this talk to us.
It was my pleasure. Thank you, everyone. Thank you for taking time to listen. Bye.
Bye.